This is one of a series of lectures on core clinical skills in ophthalmology and deals with evaluating patients with primary angle closure. I'm going to start by just talking about one of the ways I think about classifying primary angle closure. And on this slide, you can see that there are different colours, and the colours in very broad terms relate to the degree of intervention that you're going to need. So for example, the red colours, you'd be looking at more aggressive interventions like YAG laser, peripheral iridotomy or other interventions, whereas at the greener end, you may be looking just at observation. So if we start at the top, the first thing in this kind of epidemiological pathogenic classification is an anatomically narrow drainage angle. This is an angle in which all the structures which should be seen can be seen, but the iris approaches the angle very steeply, but you can see over the hump of the iris. The next important thing to happen is iridotrabecular contact, and the anterior segment UBM shows that very nicely on the right hand slide. Iridotrabecular contact is what it says it is. The iris is touching the trabecular meshwork, and that may be for less than 180 degrees or more than 180 degrees. When you get iridotrabecular contact with evidence of damage to the meshwork, i.e. with raised intraocular pressure or peripheral anterior synechii, we call that primary angle closure. When the angle progressively fails, such that you've got primary angle closure plus glaucomatous optic damage, we call that primary angle closure glaucoma. And then as a separate term, we use the term acute primary angle closure for what used to be called acute glaucoma in the old days, where the angle is acutely obstructed with very high intraocular pressure and a very dramatic clinical presentation. So we always start with a history in medicine. And one of the interesting things about primary angle closure is that actually, when you've taken enough histories, the symptoms can be very vague. It's not always like it says in the textbooks. Of course, you can get symptoms of intermittent primary angle closure with intermittent severe pain, intermittent halos, for example, when looking at street lamps, intermittent blurred vision, or the eye looking red.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.